Welcome, everyone. We'll give it a few minutes while the attendees join our Zoom. Welcome to our PTA webinar with questions and answers with our Superintendent Alberto Carvalho. And we are hopefully live with Facebook. Hey, people are still coming in. All right, ladies and gentlemen, welcome. My name is Sandra West. I am your president of the Miami-Dade County Council of PTAs, and I would like to welcome you to our webinar with questions and answers with our Superintendent Alberto Carvalho. And let me introduce you to our panelists. We have with us today, of course, Superintendent Alberto Carvalho.
Great to see everyone. Thank you. Good evening.
We also have with us our CFO, Dr. Sylvia Diaz.
Our CAO.
CAO.
Good evening. I'd like to be the CFO sometimes too.
And I am going to turn over introductions to our Director of Community Services, Sarah Walkup.
Good evening. Also on the call, we have Dr. John Pace, our Chief Operating Officer, Ms. Daisy Gonzalez-Diego, our Chief Communications and Community Engagement Officer. And I believe that is all on the call as of right now. We may be joining with us additional panelists as the evening goes on. And with that, I'm going to turn it over to Superintendent Carvalho.
Well, thank you very much. It's such an honor to once again be with parents and community leaders from our community. And I understand that Facebook Live is active as well. So we hope that we're reaching a wide sector of our community because more than ever, probably information at this point is so critically important, whether you are a parent, a student, an employee of Miami-Dade County Public Schools. Let me begin by thanking the president of PTA-PTSA at Miami-Dade for your kind invitation once again. Every single PTA PTA president across the district, every PTA member, every single parent for your dedication to the children that we educate every single day in Miami-Dade County Public Schools. Obviously, this is not possible without a remarkable team. Several members of that team are with us tonight. And of course, the vision and the leadership and the support of our dedicated and student-centric school board of Miami-Dade, led by our chair, Ms. Perla Taveras-Hampman, and our vice chair, Dr. Steve Gallen III. From District 1 through District 9, we know that this is a caring school system that has undergone incredible obstacles and challenges, not dissimilar from the challenges and obstacles that our entire community has gone through. But notwithstanding those challenges, notwithstanding the fact that we have seen loved ones succumb to coronavirus, or we have seen loved ones, colleagues be hospitalized as a result of COVID-19, to then be brought some degree of hope, light at the end of the tunnel, with expanded testing, and now finally the expansion of vaccination. I'll get into that in a little bit. But we're still Miami-Dade County Public Schools, and we're still that one A-rated district where 98% of our schools are rated A, B, and C. We're still that school system, despite the challenges, that can brag about a graduation rate of 89.6% district-wide, but if you really only count the schools managed by MDCPS, our graduation rate jumps to 93.1%. And yes, despite the challenges, we're still that school system that is ranked #1 in the country for 4th grade reading and 4th grade mathematics. And as recently announced, our advanced placement performance across the state is second in the country, which means that Miami-Dade, since we represent 13% of the state and we lead in advanced placement, the academics, trust me, we are sustaining and elevating the state of Florida's performance. So I am exceedingly proud of the work that our school system continues to do. I am proud of our board. I'm proud of our leadership team. I'm proud of school site leadership. I'm proud of the support professionals, but I am primarily proud of our teachers and every single person who works in the school, from the custodian to the cafeteria worker to the police officer, who all endeavor to keep our school system this A-rated school system that we know we are. Obviously, this has not been an easy journey. Since March of last year, it's been 1 year that we have lived through this crisis. And yes, mistakes have been made. We were all navigating this crisis without a handbook to begin with on how to navigate the crisis. Often we had to ride the bike as we were building it. We had to fly the plane, quite frankly, still assembling part of its own architecture, because this was a true unknown, not only to us, but across the country. But we've learned a lot, and we've done a lot since that time. We have reviewed, analyzed, and composed what we believe are best-in-class protocols. We have explained what those protocols are to our family of parents, to our employees, and the importance of us collectively as a community in adhering to those prevention strategies, including, obviously, and it merits being repeated, wearing a mask or a facial covering, maintaining social distance, washing our hands constantly, and in our schools, obviously, utilizing enhanced sanitization techniques before kids arrive. Also equally important, the health screenings that our employees go through, which are done online prior to arriving at work. It is this combination of COVID-19 guidelines and protocols, which are on our website at www.dadeschools.net, inclusive of the handbook for COVID-19 that is applicable both to employees as well as parents, that we believe we have been able to maintain a safe and secure and healthy environment in our schools. I'm here to tell you once again that I don't believe, nor have I ever believed, that we ever had a school COVID problem. We've always had a community COVID problem. In fact, now the experts are agreeing with us, and the research is actually proving that, including the recently published CDC additional information based on national and international research, and something that Dr. Anthony Fauci has been saying for a long time, is that schools have not, nor do they currently, contribute in any substantial way to the increase or the transmission of the coronavirus in our communities. The other way around. It's the failure of embracing and adhering to the protocols and the guidelines in the community that result in cases being brought to schools that then result in a significant disruption to our educational environment as a result of mandatory quarantining. So since we have reopened schools, I know the guidelines from the CDC have changed a number of times, and we continue to adapt to those changes. We know that since we have reopened schools, we have seen an increase of students coming back to the schoolhouse in some cases, some parents making decisions that are more in line with their beliefs, but also their workplace flexibility, as well as their own family health condition. And we understand and respect that. That's why we take pride in being a choice district, affording our parents, our families, the ability to make a decision that best adjusts to their conditions at home and the needs of their children. However, it merits being said that we have analyzed the data, and we have seen the level of absenteeism on the part of some students. And we have, through iReady as well as other indicators, noticed a significant lack of academic progress for many students in our community. So we have reached out to now about 13,000 families about 10,000 such families as a result of data leading through the first grading period. Now, as a result of analyzing data through the second grading period, we added another 3,000 students and had honest conversations about the fact that in some cases, the online process was not necessarily benefiting those children. They were falling behind. And we know the reason. Sometimes there isn't a quiet space at home for the child to do his or her work. There are multiple children in varying grade levels. It can be confusing or disruptive. We know of cases where older siblings were caring for younger siblings, not necessarily conducive to a good educational environment. And we had to intervene, certainly with the support of the state via a number of executive orders. And as a result of those efforts, as a result of calls to parents' homes, as a result of wellness checks with knocks on door by social workers and others, we have brought back to the school system for physical instruction about 7,000 students who absolutely need that additional supervision, that additional monitoring, but also that additional observation of ongoing progress to ensure that not only do they stop regressing, but they actually accelerate towards their full potential. Now we're at a point, quite frankly, where we are attempting to improve the process of quarantining, being more explicit, and we'll be releasing some additional information to the community about new guidelines for quarantining. We're in the final throes of conversations with the Department of Health here locally. We believe that considering the positivity rate currently, also considering the level of student need, and considering the fact that there are students in our community through no fault of their own who have been quarantined 2 or 3 times. That is an excessive amount of disruption to any one instructional environment. So we will be releasing, we announced to the board recently, new guidelines regarding quarantining for employees and students, still adhering to the highest level of public welfare and care based on science, but I think to alleviate the amount of time that some students are forced out of a school. In addition to that, we are exceedingly pleased with the fact that the state of Florida, based on the latest executive order published by Governor DeSantis, has once again announced the eligibility for another group of individuals, those who are 50 and older, inclusive of police officers, certainly first responders, but for us, critically important, not only teachers, but employees of the school system that have direct contact with children. That is critically important to us, if in fact, and I believe they are, our professionals, teachers, bus drivers, paraprofessionals, bus aides, cafeteria workers, custodial staff, police officers, if they are essential personnel, and they are, if they are frontline professionals, then they have to be prioritized. And we first saw that with a 65 and older, where through our partnership with Jackson Health, we were able to vaccinate over 1,000 such individuals with no wait. We're now seeing eligibility being relaxed, being brought down to individuals 50 and older. And that is a significant number of individuals in our school system, employees. And that's about 16,000 employees in our school system that meet that criteria. Obviously, it is prioritized. The prioritization for access to the vaccine is for teachers, school site personnel, and those who have direct contact with our students. And again, I mentioned some of those titles. As we speak, employees are being notified about their eligibility, which becomes active tomorrow, Wednesday, March 3rd. Obviously, they can get vaccinated at any one approved site where currently vaccinations are being dispensed in our community. In addition to the federal site, which is at Miami-Dade College North Campus. But in addition to that, we have been able to secure, once again, via our partnership with Jackson Health Systems, a special allocation where this coming Saturday, we will be able to provide direct slots with appointments to eligible employees, and those employees are being contacted directly through our school system. So we're very grateful to Jackson Health. We are in the process of negotiating with other public and private entities for the expedited vaccination of eligible employees in additional sites with no waiting. We'll be announcing those in the near future. But I don't think we're there yet. I think that the 50 and older, even though we're thankful for that announcement made yesterday, I think every single teacher, every single person who has direct contact with children in our school system and across the state must be prioritized for COVID-19 vaccination. If in fact we are serious about maintaining our schools open, if in fact we're serious about protecting the well-being, the welfare, the health, the safety, the security of our kids and our employees that we cherish so much, then we ought to make, on a prioritized basis, the vaccine available for every single employee, regardless of age. And that is a priority of our school board. That is a priority of this administration. And we will continue our advocacy efforts to get to that point. We are pleased that additional vaccine makers are being added to the existing ones. We're pleased with the fact that new federal orders have, quite frankly, enacted processes that will accelerate the utilization of manufacturing potential in this country to provide additional vaccines that we believe will accelerate the possibility of every single employee in the school system becoming eligible for the vaccination. As we stand right now, parents in our community are still pretty divided. 48% of our parents are sending kids to school for physical learning, and about 52% are keeping them at home under MSO. I visited a number of schools this past week. I'll be visiting more schools this week. I was actually pleasantly surprised that every single school that I visited had a higher than 50% level of physical attendance. And I saw orderly environments with caring teachers, well-led, clean, with the appropriate social distancing that is being recommended by our school system, with students actually miraculously almost, but I think it's ingrained upon them, following the guidelines and wearing their masks. And the only time I would see them without masks would be in a cafeteria setting or a classroom, but then the social distancing would be greater as they were eating. So we are pleased with where we are, but there's so much more work to be done. And we are deeply concerned, quite frankly, about the academic regression. That's why we're going to be making significant announcements. This too is a board priority about summer school, an accelerated, intense, very strategic, and very personalized effort of connecting those students who academically are in greatest need with the resources they need during the summer. It is our intent to open as many schools as possible and bring as many students as possible to the schoolhouse throughout the summer through staggered schedules and staggered opportunities on the basis of the individual need of the student. You know, national data is indicating that the academic regression, the learning loss that many students are experiencing will be historic in nature. And now is the moment. Quite frankly, last summer was the moment that we did it. We continue to provide additional support for fragile student populations, and we will accelerate those supports significantly moving into the summer months. Additional information will be provided to parents regarding these offerings. We are pleased with the level of federal support that we have received. We have now received ESSER and GEAR federal money. This is stimulus money under the CARES Act that have supported our acquisition of PPEs, of cleaning equipment, of cleaning supplies, and will continue to help us in the near future. There is a second stimulus package approved under the previous administration that will bring also significant resources to the school system. And then there is another set or another phase of federal investment in the works. It has passed the House. It is in the process now of being debated in the Senate, whose approval, if signed by the president, will bring much needed resources, not only for right now, the coming year, but the next 2 or so years. For those who believe that too much money is being thrown at the problem, trust me, economic conditions at the state level are very dire, with a $2.5 to $2.7 billion deficit position, and that deficit position cannot be cured with education dollars. So the federal protection is important now more than ever, if we take into account the long-term needs that our school system will have in terms of physical needs, PPEs, cleaning equipment and supplies, but also the necessary academic supports for our students. So in addition to that, I think that the importance of, now that we have a vaccine, of continuing to test employees and students is critically important. And we have terrific partnerships with the University of Miami for mobile units that travel to our school system. The deployment is announced on a weekly basis for the testing of students. We have 3 designated sites at no cost for the testing of employees and their dependents. And then since March of last year, through our self-insurance program, we have supported the individual and independent testing at the highest levels, PCR testing of our employees. We are committed to continuing these services for as long as needed. One last point on COVID, the dashboard is up and active, but I want to be clear about one thing, and this always comes up. Parents will always get a call, employees will always get a call about a possible positive case in a school that may require quarantining before the information is actually uploaded on the dashboard. There's a reason for that. The information is verified for students, for employees self-declare. The information for students is verified and confirmed by the local health department prior to being uploaded online. And last but not least, because I think that this has been critically important for parents, and I get emails about it, I get text messages about it. You know, there's nothing like sports, athletic activities to motivate school spirit. And I know that, like many districts, we have been pretty rigid about attendance at those athletic events. My friends, I think now is the time to, as a result of very productive and fruitful conversations with the Department of Health, with our medical advisor, Dr. Page from Jackson Health Systems, and soon to be had with our panel of health experts to allow us to relax attendance at athletic events. We believe that we will be able to make some announcements in the latter part of this week regarding limited attendance to begin with at outdoor sports, but in some cases also the remaining indoor sports yet to be played. It is the right thing. We're going to be asking the collaboration as we provide a lot of information of the parent community as we relax these protocols for the benefit of our students and, quite frankly, for the benefit of our parents who want to see their students compete and succeed. And last but not least, before I transition to the questions, 2 important topics. Number one, state assessments. I know I'm going to be asked, so let me disclose up front the fact that the state of Florida has decided and has announced to all 67 school systems that there will be state-mandated assessment in place this year. That will take place unless something dramatically changes, which I don't think will. Tests will be provided to students from particularly state assessments for all the applicable grades. The second element that I've been asked a lot about is specifically for parents that have students in MSO. The concern, my child has been at home successfully being educated from a distance. Why does my child now need to go to school for the purpose of the state assessment? That is not our rule. The state is requiring even those students who are learning under MSO to report to the school site for the mandated assessment. The state, as a result of much conversation with individual districts, has made some concessions. They have expanded the testing window by 2 weeks allowing us to stagger the process to ensure that at any one point we do not have a great concentration of students in any one building. In addition to that, obviously, we're going to leverage non-traditional educational space for the purpose of testing to maintain the appropriate social distance. And the last point, graduations. Nothing marks the culmination of student success like the senior year graduation. And we announced to the board and announced to the community at large that not only are we exploring, we are fairly certain, unless conditions change dramatically, we're fairly certain that we will be able to honor this tradition of in-person graduation for the class of 2021. Obviously, we're looking at the availability of venues, non-traditional venues where social distancing will be appropriate for the benefit of our students. I'm not ready to speak yet about prom or class ring ceremonies. Class ring ceremonies seem quite likely under very controlled conditions. Prom, however, it's a subject that we continue to have discussions about, and we'll be making those announcements in the near future. So the PTA is the most forceful entity. It is our army of advocates in Tallahassee and Washington, D.C. with local government for the protection, the benefit of our students and our teachers and our school system. So I am counting on all of you to continue to join hands with us as we advocate in Tallahassee, as this legislative section has just begun, as important bills are debated, as appropriations debates take place. Our children, our teachers, our school site and support staff needs to continue to be prioritized. With that said, I am ready to entertain your questions, and I know that I have very qualified team members alongside me to help me in answering some of those questions. So back to you, President West.
Thank you, Superintendent Carvalho. And yes, the questions are coming in. For those who have logged on, there is a Q&A button at the bottom of your screen. You are welcome to pose questions, and we will try to answer as many as possible. Two questions that came in very early. Is there any outlook that the vaccine will be mandatory for staff and teachers in the school system?
So at this point, I'm not getting that read from state entities, and certainly that does not seem to be a reality, certainly not for this school year, and very unlikely even for next school year. So the determination regarding mandatory vaccination is made by the state Department of Health as well as the Department of Education. And we have not received any communication to suggest that. Let's remember that there isn't, as of yet, any approved vaccination for children at this point that's widely available. And so there is still a long road ahead. And I am absolutely convinced that for this school year, there will be no such requirement. And at this point, based on what we know, it is quite unlikely that such requirement would be in place going into the 21-22 school year.
I'm seeing several questions here about students who are currently on MSO returning to physical school, both now and next fall. What is the outlook for that?
Well, you know, if they're returning to school because conditions at home changed or because their parents feel that these other students I addressed either are accumulating excessive absences, they are not sufficiently engaged, or are regressing academically, they're really experiencing a learning loss. We're ready to welcome them right now and certainly going into next year. We are ready to welcome current MSO students into the physical environment. We have the capacity, we have the resources, we have the manpower, and now with the acceleration of COVID vaccination of our workforce, that creates an even more suitable, protective environment. We have not experienced thus far a single example in a school site where our threshold for capacity has been compromised. we're still able to maintain the social distancing, the protocols and mitigation strategies that we have mandated on school sites. So we are ready to welcome those students. I encourage parents to call the school's principal or a counselor or someone in the administration should they wish to change the modality for their children. And let me take advantage of your question, Sandra, and tell parents that I'm often asked, how about the reverse position? What if going into next year, I want to keep my student in a virtual environment or distance learning? Well, number one, the state of Florida right now in the school system for a long time has provided that option. There is Florida Virtual, there is Miami-Dade Online, but we're also working with the state in conversations regarding the possibility of continuing additional options for parents, inclusive of something very similar to what we currently offer under MSO. Now, that would require the state's agreement regarding the funding of that model of education comparable to the traditional funding that school systems receive for students who attend school physically. For this year, that is guaranteed. Both modalities of learning, physical as well as online, are equally funded by the state, but that's under an emergency, an executive order that will end with this school year. So we are in conversations to see what the possibilities are going into next year.
Okay. And I believe that took care of a couple of other questions while we're at it. So there's some very specific questions here. Will parents, here's one that's very apropos to our PTA audience. When will parents be allowed to volunteer on campus?
Not soon enough. So I am certainly hopeful that, and that's another body of work that we are currently researching and addressing. But we're certainly hopeful that with the rapid expansion of vaccination, not only for the benefit of our workforce, but parents in our community, that perhaps till this school year, some guidelines can be revisited and established regarding and not only greater access to the public to schools. I described attendance at athletic events, but also parent volunteers in schools, assuming that they meet certain criteria. We're not there yet, but that is a topic of conversation with the health experts that we convene on a periodic basis and with our medical advisors. But it's not lost to me that, look, schoolhouses are the people's houses, and they are better with the presence of volunteers. I feel the same way about the mentoring experiences that we usually afford kids, internships. Everything has been transformed, everything is virtual. We want to regain a level of normalcy, but without sacrificing the prerequisite safeguards that we currently have in place. So it's something that we are in discussions about, and I believe that to the extent that vaccinations in our community reach a level that in a verifiable way would make the school community, the parent community, our own workforce as frontline workers comfortable that we've reached a point where it is safe to do so, then we'll transition to that level of community engagement and presence in our schools.
Well, I love to hear that parents are itching to get in and volunteer. Let's switch to testing. There are several questions regarding FSA testing and advancement to the next grade level.
Yes.
Is there any guidance from our legislature about whether or not students are going to be held accountable for their testing results?
So I will be soon sending a number on our board that's taken a very strong position on this matter. We are doing all that we can. And in fact, a letter will be sent to the Commissioner of Education very soon, once again, restating our position, particularly now that the federal government has lifted some of the federal testing requirements. to the extent that the states request it. So states actually have to request of the federal government a waiver from these accountability requirements. So I described earlier that the state will absolutely assess students. The question now is, how will that assessment data, that test data be used? I'm one who believes that the validity and reliability of that data is not going to be equal across even our school system, much less across 67 school districts in the state. And my concerns regarding the validity and reliability of that data are well-based, are well-founded on the fact of one element that I described earlier, the quarantining of students. Some students have been quarantined more than one time, 2 times, 3 times. The same is true across the state. That creates an uneven playing field, no matter what, for students across the country. So that, no doubt, could have an impact on test results, test conditions, level of anxiety, particularly for MSO students who are now being returned to the school, could have a collateral impact on results. In addition to that, considering the questions regarding reliability and validity, assigning or influencing a teacher's evaluation on the basis of that data may not necessarily be a fair and just thing. Assigning school grades or relying singularly almost on a 3rd grade test for the promotion of a student or end of year assessment for the graduation of a student, considering the factors that I just described, may not necessarily be the most prudent thing to do. So our board has taken a strong, righteous position on this matter. We are advocating that to the extent that the state assesses, fine. However, the accountability consequences, the accountability application of those test results should be halted for 1 additional year, should be paused for 1 additional year based on the conditions we continue to experience, which provide for uneven and quite frankly, very unequal environments across the entire state of Florida. So that's my personal position. This is a board-approved policy position that we are advocating strongly. And I know that our teacher unions are with us, and I know that the PTA-PTSA organizations are with us in this matter as well.
Absolutely. We agree that we should be held harmless for this year's testing results.
Correct.
And as a baseline for future assessment. Now, one of our questions is specific about the types of tests that are mandated. Of course, there's the FSA you've mentioned, POC. Now, the PSAT and SAT are national tests. Are they mandated?
They are not. They are national assessments, not mandatory. Obviously, as a school system, we make them available at no cost to students because there's value. Obviously, I mean, in terms of college placement and college acceptance, scholarship eligibility, they are important tools, but they are not mandatory. But I know Dr. Sylvia Diaz is with us. I don't know if she would like to chime in on this. I thought she was. Yes, she is with us. And we're speaking specifically about the SAT, which is obviously not a mandatory, not mandated, but it can be used. An SAT score or an ACT score can be used as concordant scores to make certain students who do not meet the eligibility criteria for graduation based on a 10th grade FSA or the end of course assessments, they could still be able to graduate with a concordant score on the SAT and ACT. So even not mandatory, they could be helpful to some students and certainly helpful in scholarship acquisition or college entrance. But Dr. Diaz?
Thank you, Mr. Carvalho. Good evening, all. So there was a question in the chat also about PSAT and students that had missed the PSAT administration earlier in the year and whether or not there was an opportunity to make those up. So We've provided schools with information about how they can order tests. So for students who did miss the PSAT and would like to go ahead and participate in that. In addition to that, yeah, we are administering the SAT. That is an optional test. We've got a school day administration of that will be coming up as well.
Dr. Diaz, while I have you, another questions have come up since we started about the FSA and its mandatory assessment.
So FSA is mandatory. We have to administer the state assessments. The issue around penalty, what happens if my child doesn't take that test? Is there a penalty? Really the penalties around, a lack of participation are on schools and on the school district, not really on children. There is a requirement in third grade, right, that children pass the FSA, but there's the portfolio assessment that can be used for good cause promotion in third grade. So there's nothing punitive. There are also with the EOCs, those tests, right, contribute to final grade, but we are always looking in our district about making sure that these types of things don't hurt kids, right? That there aren't penalties associated with these tests.
And that is one of the most recent questions, is they asked if the EOC had not been taken last year, will it need to be taken before they graduate?
They need to pass the algebra test if they didn't take that one, or they're going to need an SAT score, a concordance score to be able to graduate. Correct.
Okay. Let us switch to a happy question. I saw one in here. When will graduation dates be determined? Who wants to take that question?
I know that our COO, Dr. Pace, is on the line with us, and with a terrific background. And we're in those conversations right now. We are doing venue assessment. In fact, they're going to take me on a tour of venues, I believe, as early as next week, to ensure that, in fact, they are suitable. So we're not ready with dates, but Dr. Pace, can you be at least tentative in a timeline for graduations?
Yes, Mr. Carvalho, and good evening, everyone. As Mr. Carvalho said, we are exploring every option we can to have in-person graduations for our 2021 class. The window, I can't give you a definite date at this time, but the tentative window we're looking at is pretty similar to our window in previous years, which we're looking at a late May, early June. However, please be patient and wait for us to get that information out to you, because that will be totally based on the venues that we explore. And hopefully, and I'm going to be very optimistic, I'm optimistic it'll work out, as the superintendent said. It'll be based on those venues, and we can give you those dates as we secure those venues based on our practices of social distancing.
All right. I'd like to turn to some questions of legislative priority, since that was one of the topics that we said we would discuss today. What effect do you think State Bill 48 will have on our system?
Well, obviously, Senate Bill 48 significantly has the significant potential to expand the current environment of the so-called scholarships for students, which are in essence state dollars that are utilized by parents to access educational services in non-public schools, private schools. Senate Bill 48 coalesces a number of those current scholarships, such as McKay, Gardner Scholarship, and expands also eligibility and availability of those scholarships. So the direct impact to the school system from strictly, a business perspective is that a significant amount of revenue who would follow the children whose parents would take advantage of these scholarships could be lost to the school system. And some people simplify that occurrence in a way that quite frankly merits some degree of explanation, because when a school, for example, loses 5, 10, 15 students, it still has a principal, it still has its custodial staff, it still has its maintenance staff, the police officer, and you cannot send a piece of that officer away because those students were lost. So the reduction across the district could be significant in terms of FTE, in terms of funding. And look, we are a choice-driven school system. We offer terrific public school choices in our school system. And obviously, there are many partners in the educational spectrum in our community, which include private schools for the parents who, for religious reasons or other reasons, choose to avail themselves of those opportunities. Charter schools, publicly funded, independently managed schools, and a choice school system really puts the parents in charge of making those decisions. One thing that has been part of our legislative platform for a long time is, to the extent that those scholarships are approved and enabled, then let's ensure that the accountability requirements follow them. Not only the fiscal accountability requirements, but also the academic accountability requirements, because public dollars are being spent in those investments. But should there be a significant number of takers, the financial toll, the immediate financial toll in the system could be significant.
I'm not quite sure how to ask this one. It says, can you explain about the surprise bill in the Florida House that proposes changes to the Bright Future scholarships, but they did not reference a specific bill?
So the state of Florida has over fairly recently changed the criteria for Bright Future scholarships, and the criteria, as a result of that change, which added the number of points, minimum points for eligibility for Bright Future scholarships, could significantly, and I believe will significantly impact a community like Miami-Dade, as it will disproportionately impact students in poverty, Hispanic, African-American students. We've actually done a calculation in terms of potential impact, and a significant number of students who otherwise would have been eligible for Bright Future scholarships in the past under the recent criteria would no longer be eligible. This is particularly painful to me because if we're talking about students who were not in high school, so they were in 8th grade, it may be a reality that they will, quite frankly, go into anew. However, a number of the students impacted by Bright Future criteria change were already in high school when the criteria changed on them, making it not necessarily fair for them, because it seems that the rules of engagement changed after the game began. And that does not seem fair to me. I hope that this is what the person who asked the question was referencing. And I don't know, Dr. Diaz, if you want to add something else to this matter.
Perhaps there was a reference to the proposed change that has to do with students who have taken advanced placement courses and a reduction in their Bright Futures based on their participation in advanced placement testing. And I have just read about that, so I'm certainly not expert, but what it looks like to me is it will be bad for kids, especially poor and minority children who participate in these programs in high school and do well. It's going to work against them in terms of their college funding.
All right. The next question I think might actually be to me. Can you please do a video message to parents about making safe choices and taking less risks for spring break plans that we can share out with our parents. I think that would be a lovely idea, and thank you for the suggestion.
And Sandra, we will. That I'm so happy that that you lifted that comment or question, because we are concerned. You know, we saw what happened in our community right after the holiday break, the winter break. We saw a rapidly increased positivity rate, which no doubt impacted our schools, triggered a whole host of quarantine effects in our schools, and that can be avoided if we, quite frankly, condition and monitor our own behaviors. So we are concerned as we go into spring break about that repeating itself. So we will be putting a lot of messaging out, and I appreciate the fact that you will as well, reminding parents to remind their kids, and for the parents, the adults themselves, to be cautious, to maintain the protocols in place, to not add to the positivity rate in our community, as that would only make it more difficult for our schools and our professionals. So important point. Also, spring break, we will be activating a number of schools for Spring Break Academy to provide the continuity of learning for the most fragile students, those who continue to experience the greatest learning loss, the greatest academic regression, or those who accumulated an excessive number of absences. We know who those students are. We'll be providing that information to the community in a very near future.
On a similar question, will programs like iReady be available to be used during the summer months to help to alleviate academic loss?
Dr. Diaz?
I anticipate that we will be able to access iReady in the summer. We've kind of vacillated different summers, you know, changed our thinking around that. But this upcoming summer, absolutely, I do anticipate it will be available.
It'll be one of many tools available to parents, students, and teachers during the summer. As I said at the beginning, this summer school is going to be like no summer school that I recall. We really hope to have a large number of schools open. We'll be using federal funds to support these students in these schools. We hope we have the manpower that we will need, and obviously with the appropriate compensation, but the need is that high. And that's why we are feverishly planning the multitude of programs and experiences for students, targeted based on the specific need of the student going to the summer. And iReady, I'm pleased to hear, you know, a parent asking about iReady, because I do think it is a very, very good tool at many levels. It's also a very good predictor of student success, but it's valuable in terms of its research-proven ability to really help students in an educational environment alongside their teachers.
I see this question a couple of times in the chats. Is there a mandate that school libraries must be closed at this time? And when would libraries be reopened?
I would defer that question to our COO, Dr. Pace.
Can you hear me? Oh, yes. There's no mandate that libraries are open. I actually saw that question. I was going to reply to it. I still will. There are some schools that may be using the media center as an instructional classroom or an instructional facility, and therefore the media center may not be as available as it has been in previous years. And if that is the case, that may be what we're speaking to. However, there has not been a mandate that the instructional media center, the libraries, are closed. They may be used differently this year in order to accommodate spacing as far as instruction for social distancing in some cases.
Okay, thank you. There's also a couple of parents who are asking specifically about the Cambridge program. Are the kids in the Cambridge program supposed to take those exams this year?
Dr. Diaz?
So yes, right now, the students in the Cambridge program are supposed to take their exams. We have sent a communication to Cambridge asking for some flexibility to implement a series of local assessments similar to what was done last school year with IB. We've asked for that model from Cambridge, so we're waiting to have that conversation with them.
Okay. There are several questions, follow up on PTA activities in schools. I think I could answer that. We need to keep our students and our staff safe, and the best way to do that is to limit the number of people in the school system that need to be tracked on a daily basis. So I know that it's a difficult year, but PTA needs to remain as virtual as possible and as social distance as possible. As we go through this, we are coming up with new ideas for PTA activities in the school that will meet our social distancing. Now, there is a question in here about the unfortunate consequence of a stigma associated to people who have had COVID or have been COVID positive. What is the school system doing to try to help with that social emotional outcome of a COVID positive result?
So thank you for the question. I mean, that's actually a heartbreaking one, right? Because, and it's one that just recently I was personally asked, and you used words that quite frankly represent the solution. So the social emotional support through our qualified staff, our mental health professionals, our counselors, our school psychologists, in addition, quite frankly, with the mutual responsibility that we all have as parents to have honest conversations with children about the fact that having contracted COVID does not make you a pariah, and quite frankly, once you've contacted COVID, you're much less likely to pass it on to anybody around you. So you have some degree of immunity. You have the antibodies. So it is scientifically and logically, false that individuals who have had COVID should be in any way looked upon as a threat or something other than someone who was infected with the virus, as millions of Americans have been infected with the virus, and is now within our environment in a safe way. We'll continue to use the resources available to us and stress, quite frankly, to our school leaders to pay closer attention to this issue and provide the appropriate messaging. I was asked one time about it. It is not an issue that I, quite frankly, have confronted or faced frequently. One single person asked me about it, and it was actually our kids who were quarantined, or a kid who had, COVID, or a teacher. When they return, how did the other staff members feel around them? And we have not detected, quite frankly, any negativity towards students or employees alike. I think because most people, quite frankly, legitimately and logically understand that once you are past a certain period of time, once you've tested negative after you were positive, once you have those antibodies, you are probably safer than somebody that you may be around on a regular basis, short of those who've been vaccinated. But we'll continue to pay close attention and ensure that the right messaging is provided regarding this issue.
Thank you. Now, this question was asked in a few different ways, but it's all the similar. There is a question about having cameras on during MSO classes. Parents were under the understanding that the cameras should be mandatory at all times, but they're seeing some differences in the implementation of that.
So for every single student who is on MSO, the camera should be on at all times. And I know sometimes it's difficult based on the age of the child, but that is a pretty strict guideline that we embrace, and it's necessary if we are to monitor the level of engagement of the student, if in fact we are to really attest to the student's presence, and I'm not talking about physical presence, but for the purpose of attendance. We have noticed that some students earlier on were logging on, they were seen for a little bit, they would disappear. And the only way to verify, to ensure that there's continuity of learning, is on a basis of continued engagement. And the only way to do that is if that ability of a teacher monitoring the presence of the student via the camera being on at all times. Dr. Diaz, would you like to add to that?
Sure. We ask that cameras be on. I think probably what's happened is that teachers have perhaps tried to be a little bit flexible. There have been concerns with some children about, the cameras being on and what's going on in the background at their homes. So I think that's probably what you're seeing is, compassion and flexibility.
All right. There are many more questions, and I'm afraid that we are running out of time to answering all of them. We're going to take one more question, and this one has been asked a couple of times. Will VPK in kindergarten be included in the summer school plans as they were not included in previous federal tutoring programs?
So it is our plan. We have a list of all of the different things that we'd like to include in our summer program this year, and VPK and kindergarten students are absolutely part of that.
All right. Well, thank you so much, Superintendent Carvalho, Dr. Diaz, Mr. Pace, Mr. Bueno, Ms. Walkup, for joining us this evening, Ms. Daisy Gonzalez. This has been extremely informative, and I know that, as always, we have more questions than we can answer in a reasonable amount of time. Is there any other final thoughts?
Just very briefly, Senator, thank you once again for the opportunity to be with you. We will continue to have these engagements, particularly now as we have launched based on board action on the strategic plan for 21 through 26. I can assure you that the PTA-PTSA, our parent community, will be extremely engaged in these processes. So our conversations will accelerate. Secondly, thank you so much to the parents who are present for your guidance and dedication to the kids and your support of our school system. We know that these have been difficult times. Your patience has been terrific. Your support has been indispensable. I really want to thank you for that. And lastly, for the questions that you have, Sandra, that were not responded to, if you go through them and you quite frankly reduce them down to similarities between some of them and shoot them over to us, we'll be more than happy to respond to them, and then you can put them on your PTA websites or mailers, whatever you'd like to do. We'd be more than willing to do that. Once again, thank you so much for the opportunity. And it's a pleasure to continue to have these engagements with you.
And our next outlook for having this event is May 4th. So we hope to see everybody then.
Thank you very much. Good night. God bless you all.
Good night.